Okay, today I'm going to be doing my adult health assessment for the purpose of making sure that my hand placement is visible. The patient might be placed in certain positions, but okay, I'm going to begin with washing my hands. Okay, I'm walking into the room. Okay, hi, how are you?
Fine, thank you.
Good. My name's Shannon. I'm going to be your nurse today, and I'm doing a complete adult health assessment, okay, head to toe. It's just going to give me an idea of your overall general health, okay? It's going to involve me inspecting your body, using different tools like a stethoscope, and touching your body. Are you okay with that?
Yes.
Okay, great. Can you identify your name and your date of birth for me?
Therese Leahy, November 22nd, 1948.
Okay, perfect. So let's begin. First, I'm assessing the symmetry of her face. I'm looking at the palpebral fissures and then the nasolabial folds to address my symmetry, which everything looks good. So I'm going to start by palpating the head all the way back, and I'm just feeling for any lumps, bumps, masses of any kind. None. Okay. Temporal artery, we're going to palpate that on either side. And then the temporomandibular joint. Go ahead and open and close for me. Okay, perfect. Again? Excellent. Okay, so we're going to move on to some cranial nerve tests. Can you clench your teeth for me? Excellent. Smile really big. Perfect. Puff out your cheeks. Excellent. Then you're going to squeeze your eyes really tightly. Excellent. And then wrinkle up your forehead. Perfect. Okay. So we're going to move on to inspecting and palpating the ears, looking for any redness, swelling. You're going to palpate, see if she reports any tenderness. You can look for any kind of discharge or growth. Excellent. Other side. Okay, perfect. We're going to do the same thing for the nose. Looking, feeling, sinuses. I'm going to go ahead and close one side of your nose with my finger. You're going to breathe in and out with the other, okay? Other side. Okay, good patency on either side. Now we're going to take a look at the mouth. It's a good time to check hydration status as well. So we're looking at the lips, inspecting them, looking for any sort of sores or lesions. You can move them away to check out the gums, looking for any signs of infection or bleeding. For teeth, we're looking to see if we see any broken teeth, any signs of decay. We're going to move the tongue up to check the base and the floor of the mouth. Everything looks normal. You're going to stick out your tongue and say, ah, to look at the uvula. And you can check out the posterior pharynx as well. Okay, perfect. At this time, I'm going to check your eyes out, okay? So you're going to follow my pen, leaving your head straight forward, okay? Eye movements follow. Okay, perfect. Now we're going to do a visual field test, okay? So you're going to cover your right eye. I'm going to cover my left, and you're going to tell me when my finger comes into view by saying the word now.
Now. Now. Now.
Okay, perfect. Other side.
Now. Now. Now.
Okay, great. Now I'm going to dim the lights, and I'm going to shine a light into your eyes, okay? Even when you see the light, you're still going to maintain looking at my nose, okay? Not at the light. Excellent. And her pupils are equal and reactive to light, which is great. Okay. Now I'm going to stand behind you and I'm going to assess your thyroid, okay? Perfect. So you're going to sit up nice and tall, and then you're going to lean your head slightly forward. You're going to feel. Okay, you're going to lean to the right, push right, palpate. Okay, can you swallow? Excellent. Okay, now lean left, push left, palpate. Okay, swallow. Okay, great. So this is a good time to feel the lymph nodes. We're going to feel occipital, preauricular, postauricular, submaxillary, submental, tonsillar, and then the anterior cervical, the posterior cervical, and then the supraclavicular. Okay. So we're going to palpate the carotid artery on one side, and then the same on the other. And then we're going to auscultate using our bell. Okay, perfect. And now we're going to examine your heart. Okay, first we're going to feel the arteries, so the radial, and this side as well. Perfect, and then you're going to lay down for me. Sounds Okay, you can continue to lay down for me. Just shift slightly toward the left. So you can examine the patient sitting up, lying down, and even more towards their left side. So I'm going to listen to the 5 points of the heart using my diaphragm. The aortic, the pulmonic, Erb's point, tricuspid, and then mitral. S1 can be heard using the diaphragm at the apex. S2 can be, you can use the diaphragm or the bell, and it can be heard at the base. And then S3 and S4 can be heard while the patient is laying on their left side using the bell at the apex. Okay? Go ahead and sit up for me with your back facing me as much as you can. Okay. Okay, a little bit more. If you can get your legs up, please. More. Okay, excellent. So now I'm going to be percussing the lung fields. Okay, perfect. Test your cortical, vertebral angle tenderness at this time. We're going to feel like a large tap. Tell me if you feel any tenderness. Okay, perfect. I'll listen to the lung fields using the diaphragm. Breathe in and out through your mouth, okay? Okay. Now you're going to repeat the words 99s as I place my hand on your back.
99, 99, 99, 99, 99, 99.
Okay, perfect. Okay, so now you can turn to the front. You can percuss along the chest as well in the same manner, moving aside any breast tissue. You can auscultate as well. In and out through your mouth, okay? And then laterally. And then the other side. Okay, excellent. Okay. So now you're going to lay down for me. We're going to take a look at your stomach. We're going to drape the patient appropriately so they feel most comfortable. We're inspecting, we're looking for any bulging, any sort of movement, any fluid shift, any sort of masses or anything like that. And everything looks nice and symmetrical. Then we're going to auscultate the bell sounds using the diaphragm on our stethoscope in all 4 quadrants. Okay, perfect. Shift a little this way. Excellent. Okay. Now we're going to switch to our bell and listen for the vascular sounds. The aortic, the renal, the iliac, and the femoral. Okay. Now I'm just going to do like a general percussion. Okay, great. Now I'm going to percuss for your lower liver border, okay? Okay, so you wait for the sound to change, which will be right around there. Now I'm going to palpate lightly all 4 quadrants. And then you go in and do a more strong palpation. Okay, perfect. Now I'm going to palpate the liver. So on the left side, bring your hand up, pushing in. Okay, we're going to do the same on the left to palpate the spleen. Okay, and then we're going to do the right and the left kidneys. So, feeling the back, pushing this way. Okay, and then repeating on the other side. Okay, perfect. And last but not least, we're going to palpate the aorta. Okay, perfect. Now you're going to sit up for me. We're going to check your neurological status, okay? Perfect, okay. So you're going to turn your head right against, I'm going to push the other way, perfect. Turn your head left, excellent. I'm going to push down on your shoulders, you're going to shrug up. Perfect. We're going to do kind of a flipping of the palms like this, but patting your knees, okay, as fast as you can. Excellent. Can you do fingers to thumbs? Perfect. And then you're going to go all the fingers to the thumbs and then reverse it. Excellent. Now you're going to lay down and you're going to run your heel down your shin, okay? From your knee to your ankle, rotating outward, perfect. All the way down. And then the other side. Excellent. At this time while you're laying down, this is my tuning fork. You're going to tell me if you can feel the vibration on your big toe, okay?
Yes.
Okay, other side?
Yes.
Okay, perfect. You're going to close your eyes. I'm going to move your big toe for you. You're going to tell me which way I'm moving it, okay?
Right. Up.
Perfect. Other side?
Left. Down.
Okay, excellent. Okay, you can sit up for me now. So I'm going to check your reflexes with my reflex hammer. Okay, you're going to let your knees, your feet dangle on the edge of the bed. Perfect. You're going to pull your arms from side to perfect. Okay. Perfect. Okay, now you're going to let your arm kind of play dead and let me support the weight, okay? Okay, another side. Let it play dead. Perfect. Okay, and now we're going to do down here. I'm going to try to hold it. Okay, this is the Achilles reflex. So we're going to kind of bend out, force flex the foot. And down here. Okay. And the other side. Okay, excellent. Okay, so at this time you can stand up. Okay, so you're going to find your balance for me. Okay, and then I'm going to ask you to close your eyes and maintain your balance, okay? I'm here to catch you if you were to fall. Okay, perfect. Now I'm going to ask you to walk to that chair over there. And I'm just taking a look at your gait. Okay, when you turn around, come back, you're going to walk heel to toe, kind of like you're walking on a tightrope, okay? Okay, excellent. Okay, so we're finished with our exam, and I'm going to complete it by washing my hands. Okay, thank you.